Chapter 5, Lesson 4, Getting Help. All right, so one of the first questions you're probably going to ask yourself is, well, when do you seek help, or when do you try to get people some help? When's it needed? Well, some guidelines you can follow are on this slide, are some things on this slide, such as, feeling trapped, feeling like you're worrying about the same thing all the time. Maybe it's a deal where your sleep is being affected, or you're not eating correctly, your schoolwork or job is not going so well, or your relationships in general are starting to fail. Um, whether substances are being involved, drugs or alcohol, and then just if your behavior is starting to become really reckless or violent in such that it, is not necessarily the case all the time. Um, you can start to see signs not only in yourself but in other people when it just seems like things are just not going to correct themselves. That's where you need to start thinking about getting some help. And there's lots of places where you can get some mental health. You can go see your school counselor. They can refer you on to a counselor outside of school, but school counselors is a great place to start at. Sometimes people who have a learning or emotional behavior problems may see a school psychologist. Typically, your counselor will refer you to there, or maybe another teacher might refer you to them. But typically, you don't just walk in and go and see your school psychologist. It's kind of a bigger process than that. Sometimes you may be asked to go see a psychiatrist, or you might wish to see a psychiatrist, and those are people who not only diagnose, but they can also help treat mental disorders. They can prescribe medications, which is what the type of therapy that happens quite a bit, is that people are put on some type of antidepressant, or they may be put on some type of medication to help correct some of their mental disorders. Drug therapy isn't always the case, but in many instances it is. You can see a neurologist. A neurologist is typically someone, though, who is working with people who have physical disorders of the brain or the nervous system. Could be some type of a tumor, could be a head injury, could be a situation where maybe somebody's had multiple concussions or something. Is typically when a neurologist would be included. Someone who is outside of the school and can help with behavioral disorders and emotional disorders would be a clinical psychologist, similar to what a school psychologist does, but obviously just not in a school setting. And then a psychiatric social worker, which is a professional who um, you know helps provide treatment in hospitals or mental health clinics, or even on sometimes family service agencies. Typically, these can maybe come from the state, but again, a social worker can help try to get some of those issues surrounding your everyday life and where you can get some of that treatment figured out. The treatment methods that are used are many, and some of these are used together, and some of them are used independently. Um, you know, it's kind of goes with what the words associated with the type of therapy get into play. Psychotherapy is just basically a patient sitting down having an ongoing conversation with a mental health professional. A behavioral therapy is a treatment process which basically through rewards and reinforcements, they're trying to change those unwanted behaviors. Um, Maybe if somebody is having an issue with a phobia, they may do a little bit of therapy where the person is introduced to the activity. Let's say they're afraid of snakes. They may have them sit in the same room where a snake is in a cage, for a time, and then the next time they maybe sit a little closer, and they call it exposure therapy, but it is behavior therapy, in which they're trying to change some of their behavior by being exposed to it. Cognitive therapy, is another type of therapy. Family therapy basically is what the term suggests. Instead of doing this by yourself, you're going in as a family and you're receiving some help and trying to provide constructive ways to try to help work through their problems. Group therapy is just what it sounds like. Instead of meeting individually, you're meeting in groups, typically with people who have similar problems that you have or similar issues. And then again, drug therapy, um, just trying to find out what medications are possibly being used to help treat the symptoms or the disorder itself, is all things that can help. And again, these treatment methods are used sometimes independently and sometimes used in conjunction with one another.